Diabetes by
Anessa
Allison.
and Mackenzie.
So the definition of diabetes is that there are high blood glucose levels within the body due to imperfections in the insulin hormone. And they differ between two types, type 1 and type 2. Type 1 is found in young children and is typically genetic, while type 2 is onset from unhealthy eating and a pancreas producing insulin excess.
In type 1, the body produces little to no insulin. The lack of the hormone released from the pancreas sends a feedback, but the amount isn't enough from what the patient needs. In type 2, the body has a hard time processing blood sugar levels. The body resists a drop of insulin to move the glucose into the cells surrounding the blood vessels. This is why sometimes there's different treatments for both the types.
So some signs and symptoms of type 1 diabetes are that it can be diagnosed at any age and people don't have to be born with it. They have sweet smelling breath, extreme thirst, increased appetite and not feeling full. Their weight loss is unintentional and they're feeling lethargic.
In type 2, sometimes the symptoms are not always noticeable and they can be brushed off with something else. A lot of times in type 2, the person is overweight, which is why they could be blowing off health issues and just be blaming it on that. A lot of the symptoms are the same as type 1, including frequent urination, increased thirst, fatigue, blurry vision, and one that is different is the numbness in the hands and feet, which may be from the excess adipose tissue having left from the circulation.
Although there is no specific treatment or cure for diabetes, you can still test your blood glucose levels to figure out what types of foods you should be eating, whether to raise or to lower your blood glucose levels. And then you can also start taking medications such as insulin, or in type 2 diabetes, you will just need to create a healthier lifestyle such as exercise and healthy eating.